Good morning and welcome to let's try that again, shall we? Good morning, welcome to TherapyLive Sport, swim, bike, run. I will get my words out eventually. We are the Massage Collective, Matt Scarsbrook, Betty DeMoss-Wharton, and Anna Maria Mazzieri. Now, before we get started, we're just going to say thank you to our partners who, and actually we're partnering today with, you should hopefully see sliding out onto your screen, TherapyLive membership.
Yes.
Now, TherapyLive membership is literally the best £5 you will ever spend, because join today and you get access to all of the recordings from this conference, but also from the massive June conference as well. As well as that, we have a community for our membership made up of TherapyLive speakers such as ourselves and also the other people you've probably heard more about, podcast guests and fans. Essentially, it is just the tip of the iceberg. You'll also get early access to all the podcast content, all of the extra bonus stuff that we record in the background when we run out of time, quite frankly, but we've still got tons to talk about, bonus content that you're just not going to find anywhere else. So whilst £5 doesn't buy you a sandwich these days, it will help keep Therapy Live on air and free at point of access. So please do consider joining the Therapy Live membership today. However, right now we have our first ever live Massage Matters podcast, and we're a little bit nervous, but it's
no pressure.
So today we wanted to talk about massage in the context of recovery. Okay, so we wanted to ask the questions: what is the purpose of using massage for recovery in endurance sport in particular? And what explanation are we giving to the athlete in those circumstances? So without further ado, I'm going to hand over to Becky.
Cool. So I was absolutely buzzing that we got asked to do this because my route into soft tissue therapy was triathlon. I was use past tense because racing seems to have been forgotten about this year. But so my background was as a very, very recreational, not very good triathlete, but a very enthusiastic triathlete, I think is fair to say. And the reason I started getting interested in sports massage and massage general, and then that led me on to to soft tissue therapy, was the fact that I used it myself as a recreational athlete. So when we were asked to do this, it made me kind of reflect on what was my experience as an athlete and what did I think I was achieving when I sought out that person in a gazebo at the end of a race. And typically, as it often does, it came back to a kind of fairly structural biological answer. I thought I was flushing out lactic acid, or I thought the therapist was flushing out my lactic acid. I thought they were improving my circulation. I thought they were doing all these magical things to put my muscles back to their pre-race length. And I thought that if I didn't get that massage, I would definitely be more sore tomorrow. So for me, it was always a structural explanation, and that's how I justified it to myself. Is that I needed to go and do that, else I wasn't going to function very well for the rest of the day or the rest of the week. And unfortunately, I was never going to be a professional athlete. So I had to go to work Monday morning and I had to probably drive 2 or 3 hours home from wherever my race was. So for me, my priority was that I could carry on functioning. And I felt that massage was the best way of doing that. So the first thing we're going to think about this morning is where those physiological factors fit. Is there any evidence for them? Are they accurate? Is it even where we need to be looking when we wonder whether we should be using massage for recovery in swim, bike, run athletes?
Absolutely. And so when we dive into the research, I mean, it's the same with a lot of massage research, to be quite honest. It is a bit like you're trying to group together a lot of really bad research and try and come up with something good out of it. And when I say bad, I mean poor in terms of the consistency between studies, poor in terms of the quality of the studies, risk of bias, all that kind of stuff. Now, we're all sort of grown-ups here. We all realize that massage, it's very, very difficult to provide massage in a blinded study. You can't provide someone massage and tell them you haven't, or vice versa. So we know there are some limitations there. But when we look into, in particular, we've got two studies, a meta-analysis, that we're looking at this morning. One of which is actually really recent from earlier this year, from April this year. We see that there is a huge variation in just even what is massage. I mean, if we start with the question, what's sports massage? What would count as a sports massage to you at the end of a race? And even with that question, you then try and collate all these different research papers together and go, well, let's try and compare, do a proper meta-analysis on it. And you find out that some people are being water jetted, which I had to look up, by the way, because I was saying to Becky earlier, to me, that was people stood in a field being hosed down. But it turns out that it's actually more jacuzzi style. But then you've got your mechanical, which I can only imagine are the vibrating power tools that you see being used quite a lot. And then you've got your standard effleurage, petrissage, tapotement. But again, there's how long do you do it for? How long do you wait after the event before providing that treatment? There's a huge number of questions. And when we start looking into the research, we realize that all of the research is actually looking for physiological effects. They're looking for changes in the tissues and come up with nothing. In short.
Yeah, they're looking for very specific outcomes or very specific changes in a non-specific type of technique, because you can never reproduce the same technique. So I found that very interesting.
Yeah,
and there is that emphasis again, and I think this is, Matt's highlighted this brilliantly at TherapyLive last time. In massage, we've fallen into this trap of wanting to find a physiological explanation for what we're doing. And I think that's even more true when we talk about athletes, is that athletes tend to be the type of people that want a very clear biological explanation for something. And we have maybe in massage sort of fed into that a little bit by trying to find some explanation for what we're doing. So when we look at some of the evidence or some of the physiological markers that have been looked at, there's testing into lactic acid levels. It's firstly, that's been shown, or it's widely agreed now, that it's not really relevant, and also we're not having an effect on it. Blood flow, again, widely accepted that massage doesn't have an effect in blood flow other than at a very localized skin level. There's still the debate around cortisol levels and whether A, it matters, and B, whether massage does anything to them at all. And I've seen a comment in the comments here about asking for these papers. We will be putting out all the references we've used for this one. There is one, and I don't want to sit here again and say everything that massage doesn't do. There's some interesting work coming out now around cytokine levels, and that's an argument where I guess if we wanted to kind of say there's any promising work on a physiological level, that might be where we're looking. Again, there's a lot of argument around its clinical relevance, but there is some emerging work around that. So I think that's where I guess we stand on the physiological effects. Would that be fair, Matt?
Yeah, I think so. I mean, let's talk about these two papers in specific. So we've got the 6th of April 2020 paper, Davis et al., that was published in the BMJ Open Sport and Exercise Medicine. And we're comparing that really with an earlier study, which is Popendieck et al., which was 2016, I think. I'll find that again later. But essentially what those two studies have tried to do is collate together everything that or all the studies that referenced massage and performance recovery. And that's really, really important, because what they're looking at there is a recovery of performance, which is a measurable factor, right? That's what's important, that we can measure it. Now, what these two papers do quite differently, the earlier paper, the Poppendieck paper, is only really looking at 270 participants in total across all of the papers, whereas the 2020 paper, the Davis et al., managed to get over 1,000, about 1,012 participants in their study. And so it's a much larger study. But actually, when you dive into the two papers, what I like about the Poppendieck paper is they actually then take those studies, although it's a smaller group of participants, they take those studies and break it down and try and give us a bit of an idea of, well, when we're talking performance, what do we actually mean? And also when we do see either benefits or in some cases even negatives, what kind of categorization can we give? So to try and help, fundamentally what that first paper, that older paper, is trying to do is provide both athletes and coaches with some guidance, basically, as to should we be using massage in the context of improving performance. And well, I mean, let's dive into that. So with this Poppendieck paper, one of the to sort of summarize, I suppose, and we can dive into some of the individual elements, but to summarize what they're basically saying is, from the evidence that they've collected, there does appear to be a minor benefit to massage as a recovery tool post exercise if your measure of benefit is performance in a subsequent exercise. However, there are some limitations to that. So what they found is that, broadly speaking, you need to be providing massage pretty much immediately before the retest exercise. Okay, so there does seem to be a very, very short window of benefit from massage to see any form of performance benefit. And when we say performance, what they've tried to do is break it down into, is it how's your sprint speed affected, how's your jump height affected, how's your endurance affected, albeit they admit that endurance in this scenario is things like how many leg extensions can you manage, which we know is not particularly replicable when it comes to swim, bike, run. We're talking quite a different type of endurance there. And so what they're saying is that you need to perform the massage just before you perform the retest or the new activity, whatever that might be, and that the massage itself doesn't seem to provide much benefit beyond about 12 minutes worth of massage, and at the lower end, about 5 minutes seems to be plenty. So you actually have quite a short period that you can provide, that a short amount of time massage should be provided for. Much beyond that, you're not really getting much benefit. And in some cases, you are seeing actually a drop off in performance, in particular when you're looking at strength type work, which is not particularly what we're talking about here in endurance, but it's there. And then you need to be performing immediately afterwards. And so this starts to sort of beg the question, well, under what circumstances is this really occurring? The other really interesting bit that I love the fact that this paper pulls out is it actually looks at populations of the athletes based on their training status. And so it basically says, well, if we take untrained, trained, and competitive elite athletes, what difference does massage make in those populations? And basically, you get a greater benefit, whatever that benefit is, you get a greater benefit in untrained athletes, which interestingly, of course, is the majority of people who attend most of the events that you're going to find a pop-up tent with massage therapists like ourselves in, which I thought was really interesting.
It's really interesting, and it leads me on to my the issue I found when I was reading around a lot of the evidence about it is, again, it's the same question with massage, isn't it? Are we measuring the right things? We're looking at, we're here talking about massage as a method for recovery or its use in recovery, yet all these studies are looking into performance indicators. Guess what? I'm not going to finish a triathlon and go and jump a load. Like, I'm not. But what I need to be able to do is I need to be able, especially as a recreational athlete, I need to be able to carry on with my normal living. So actually, for me, the ones that are the studies that are more interesting are the studies that looked at those subjective factors. So they looked at perceived muscle fatigue rather than muscle fatigue, which was kind of defined as a measurable loss of strength that recovered with rest. So we're looking at perceived muscle fatigue, perceived level of DOMS, because actually to me that's far more relevant, because as a triathlete, I'm not going to, I've probably had a fairly short race. I've probably had a decent lead up. I'm probably going to have a period of rest after it, or at least reduced training and reduced racing. So I don't need to be able to perform at a high level. What I need to be able to do is get to work Monday morning and not be in agony, or I need to be able to take the dog for a walk later on. I need to be able to walk up the stairs without looking like John Wayne. These are the things that for me as an athlete were a priority. And I think even you can flip that over into the professional realm as well, is that they want to get back to some form of light training. They'll probably have a recovery week of training, and they want to be able to do that without it being a real struggle. So that for me, and we do see some stuff. There's a study by Nunz et al. That looked at perceived muscle fatigue in quads in Ironman athletes, and they found that the massage group had a significantly lower subjective pain and fatigue rating. Now, there's stuff like that, and there is stuff out there that says that to me is far more relevant than these very prescriptive biological markers and performance markers that we traditionally look for when we ask whether massage has any relevance for recovery.
If we just look at those physiological markers, then the argument of, but massage is expensive and time consuming to give that type of small changes. Yeah, I agree with that. So the argument that massage is expensive and time consuming, absolutely, I cannot disagree if we are looking at those physiological markers.
Yeah, absolutely.
Are we actually, for me, you're spot on, Becky, when you say that. Are we looking in the wrong way? Are we asking the wrong question? Are we trying to quantify something that's actually not what the athletes need to have quantified?
And I think that, go on, Matt.
No, I was going to jump in and just with a couple of the questions that are popping up, and thank you. If you haven't seen that, I've asked in the chat, pop your questions into the Q&A. We're going to try and answer questions as we go, rather than have a static Q&A session at the end like the others. But Heather Snowden's asked, are these studies just looking at effleurage and petrissage techniques rather than advanced soft tissue techniques such as trigger points and soft tissue release, etc.? And the answer is, in general, yes, they do appear to be just effleurage, petrissage, a bit of potement, but many of them don't actually qualify what they've used, and that's
the problem as well.
And that Davis study in particular, or that Davis review in particular, that I think it was like the third sentence or something, said that there is no definition of sports massage, so there is no accepted definition of what techniques would be used. And actually Matt and I were chatting off air beforehand and said it would be really interesting to send somebody for an aromatherapy massage after a sports event, or some reflexology or a head massage or something, and almost use that as your control group, rather than this traditionally accepted term of sports massage that doesn't really mean anything, because we don't massage sport.
Yeah, no, absolutely. And this is the other thing as well, is not only, there's a lot of in our industry in general, there is an awful lot of focus on specificity of technique and specificity of effect. And one of the interesting bits that came out of reading these papers is that specificity doesn't seem to correlate particularly well with when we do get results, because in particular we don't know what techniques are being used, but we still see broadly the same kind of results, and they are minor positives or negatives. We're not seeing anything massive here, and where we do have outliers, those outliers are actually fairly easily explained. But we also have differences where it's recorded in the experience of the therapist. So in some cases you've got brand new students, which is totally classic in our industry. We ourselves, we take students to finish lines because it's a brilliant place to learn what you're doing and understand what's happening essentially with an athlete as soon as they finish. But you've got students all the way up through to physiotherapists with many years working in elite sport, and they're all providing massage. And then the question is, well, is that massage any different from your student through to your physiotherapist? And is it different enough is the specificity enough that we start to see differences in the outcomes? And it doesn't seem to come out in the papers.
So I think that leads us fairly nicely onto what we'd sectioned these two out and then did kind of rethink it the other night as to whether they should be sectioned out at all. But the psychological or the biopsychosocial, psychosocial elements of what's going on in a sports massage setting. And this is what I found really interesting. And this is where I think we've probably got a little bit more value. And it caused me to reflect on my own experiences. And I started to think back and say, okay, in everything I've learned since I qualified as a soft tissue therapist, actually, let me figure out why I used to like going and having a sports massage at the end of a race. I was a really stressy athlete. I'm a really stressy person. So I was a really stressy athlete. Racing for me was really stressful. And that was something that I thrived off. So for a good week beforehand, I'd be het up. I'd be het up the night before. I'm a bit mental in transition and a little bit OCD in transition. So it was a really stressful occasion. And racing itself, although I enjoyed it, I found that I got very worked up. And actually, when I look back on it now, what I enjoyed about my post-race massages was I got to lie down for a bit. I got somebody who was giving me caring, therapeutic touch, but they were also listening to my experience. It gave me a justification for hanging around in the race village a little bit longer. It gave me that time and that space to be in that environment and surrounded by the people I enjoy being surrounded with and have a bit of a come down. And yes, that touch was valuable in that situation. I wouldn't have just laid down on the grass and had the same experience. That touch was valuable and that touch was important. But it was all those psychosocial elements that were going on that for me, that's what I needed at the end of the race, was that come down. Because otherwise, if I went home still in that state that I was in, that would be fairly unproductive for me the rest of the day. So then we started to dive into that, and there is more stuff around as ever. There's a lovely review, Nelson et al, that actually is the one that picks out that probably the most well-established benefits of massage within literature are psychological. So again, is that where we should be looking, especially when we're working with this group of people, whether they're recreational athletes or professional athletes, for whom they do tend to be quite stressy individuals. I say that lovingly.
I'm going to jump in there with a comment from Nicola Smith, which I think it speaks exactly to what you just covered there, Becky, which is in her experience, providing post-event massage, both professional and recreational athletes find benefit in even 5 to 10 minute massage. Well, fortunately, Nicola, the papers do back you up on that one. Maybe it's just a distraction, having someone to offload or debrief to, maybe the chance to get the adrenaline down a little bit. And generally, you know, massage is light pressure there anyway. So maybe it is as much the interaction with someone who has a bit of an idea of what's gone on with you, particularly if you're someone for whom, racing every Sunday is just not what you take your family to, but it's something that you love. It's quite nice to have someone who kind of gets it.
Yeah, and what is important also is the fact that it's client-centered in terms of some people might enjoy the lying down and being touched while they're lying down. Some athletes, actually, it could be the worst thing for them to do so. So it's context is really important, and it is very, very individual. We don't want to say to everybody, you will benefit from receiving a post-event or come for your massage because it will improve your, the way it will improve your lactic acid. We cannot say that anymore. And we have the responsibility of not saying that anymore. It's actually okay just saying, come because if you like to have a massage that makes you feel better, just as simply make you feel better after your strenuous exercise. However, you can go and have a bath. You can go and lying down in the grass. You can go and sitting down with your family. Whatever the clients like at the particular time.
So I'm going to direct a question directly at you then, Anna. So Lucy Searle asks, do the psychological effects outweigh the physiological effects? If you feel sore and someone makes you feel better with a massage, is that not a good thing?
Yeah, very much. Nobody is querying that. Lucy, I go back a little bit. Lucy, am I right to think so? Lucy, the name, yeah. I go back a little bit. Shall we differentiate the two? Can we ever differentiate psychological to physiological and so on? We had a lovely discussion, all three of us, regarding pain on that last night. The body is complex, and the being is complex, and I think we need to we need to stop differentiating too much between physiological and psychological and emotional. But to answer your question, for us, for me, massage is very, very, very valuable. It has certainly its place, but we need to give it and explain it with the right narrative. And we need to also accept that just because physiologically there are no clear physiological mechanism, we can accept, we have to accept that, sorry, and we actually also have to say, if a client benefit, if the client feels better, why do they feel better? And that might be because of the massage itself, but as Becky really strongly said, it's also because of the context around it. It's because of you as a therapist. It's because of the connection, even very immediate connection that the athlete might have with you. Is because he might be laying down in the tent and they feel great, he's buzzing, he's talking to the other people, to the other athletes there. It's because of all of it. So yes, if you remove massage, they might not have the same they might not feel as, they might not have the same benefit, but it's not the physiological part of the massage that gives them benefit. That is really important. It's not the specificity of the techniques that gives the benefit.
And one thing that
I hope that answered your question.
Go on, Becky. Go, Becky.
All right. So one thing that really jumped out at me when I was thinking about that and whether we can separate those out is there's some work by Trust and George that shows that fearful beliefs and pain catastrophizing obviously impact on perceived pain intensity and subjective pain. And they went on to discuss in the review by Nelson that theoretically then, if we can reduce the levels of anxiety around DOMS, that actually the effect of DOMS is reduced.
Yeah.
So there is that lovely crossover in that example. And sorry, I'm not great at quoting papers, so you're probably like, everyone's thinking, oh my God, what's she talking about? But I'm trying. If we can take that fear and that pain catastrophizing away from DOMS a little bit, and that's something a massage therapist at the end of the race is, so well placed to do. You probably are going to feel a bit sore tomorrow because you've just gone out and done this amazing thing, and you've shown this awesome capability to push your body to this extent. And you are going to feel a bit sore over the next couple of days. It's nothing to worry about. You've not torn anything. You've not done anything awful. We're in that beautiful position to help reduce some of that anxiety around that. So yes, that's a psychosocial input, if you like, but it has a very real physiological effect for that person because their pain or their DOMS or their reduced movement because of their DOMS is reduced moving forward.
The expectation of DOMS, the expectation of pain of DOMS, that in itself, it's a problem. That in itself, if we can de-threaten the brain and frame it as, this is normal, you are okay. What we should not be doing, and our responsibility now to do, is to say, unless you have a massage, you will have DOMS, because the message will create bigger nociceptor than the DOMS themselves.
So I'm going to jump in here with something that I wasn't quite sure when to put it in, but when I was doing research for this podcast, I was obviously looking at the papers, but I wanted to see what the general message was that athletes were receiving when it came to post-event massage, and I just stuck in post-event massage, basically, or sports massage into the internet, and picked up a few UK-centric sports websites. And when it comes to the messaging, we have to be better at this. Like that is one of the things that, as the Massage Collective, we are really pushing, and the messaging has to be better because we can be so damaging with the words we use. I'm going to read something here. I'm not going to name the website, but I'm going to read something here. which, well, you can let me know what you think. Can you afford not to get a massage? Without it, you will train in pain, you will get more injuries, you will take longer to recover, you will always be in danger of re-injury, and you may never reach your potential. Like,
wow.
We need to get the message out there. We all have a responsibility to the practitioner that put the message out there, he or she, they obviously have continued a false belief that has been going on for decades. But now all of us, it's all of our responsibility to say, maybe, this is not how it should be phrased. This is actually more damaging. Yeah. That's what people don't understand. Our words are damaging.
And we see that it's easy to knock therapists for that, and it's easy to knock recreational athletes for believing it as well. And actually, that persists. I remember seeing some articles just when professional sport restarted after the first lockdown, and I think there were, I'm not an expert, but I think there were some rules around they could see physiotherapists for like essential treatment if they were injured, but they couldn't have their routine post event or training massages. And I saw both Premiership footballers and professional cricketers raising concerns in the press that they would get injured because they couldn't have their post-game massages. So that, that belief persists throughout recreational sport, professional sport, and of course, if an amateur athlete or a recreational athlete reads a high-level professional footballer saying, I'm going to get injured because I can't have a massage, of course you're going to believe the same thing. Why wouldn't you? We need to move away from it, because we need to, the one day you turn up to that race and there isn't somebody in a tent giving you a massage, I don't want you going home thinking that you're going to get injured or you're going to be in pain for days.
Absolutely.
Yeah. And the other thing for me is also with that message of we need to change the way people describe massage, and we need to make people aware of what massage doesn't do. We have also to communicate to people that it's actually, if the clients like to have a massage, as long as it's given with the right narrative, that is so beneficial for the client, because that is taking client values into account. Because when I finish my training session, if I actually enjoy and I feel better by lying down and receiving a physical, actually for me it's the physical touch, because I don't want anybody to talk to me. I'm such a social. But if the physical touch for me is so powerful, makes me feel so much better, myself, I respond better with that. Other people don't, but I respond better with that. So as long as, and that is powerful. This is what, this is what I want to get across. Just because he hasn't got physiological, we cannot find physiological markers or physiological benefits. Psychological benefits are as important as. So we need to shift the paradigm that physiological benefits are the only markers that we need to use to ascertain and to validate effectiveness of a therapy, a modality, or intervention. The psychological, emotional well-being, and they cross together, like Lucy asked before, has to be what is important. Sorry, Becky.
I was just going to say that as therapists, we need to be really proud of that. So I almost feel I feel a bit worried about that person that's written on their website that they feel they have to justify their treatment that way. And you can't just be proud of the fact that, or it's not even justice. We need to be proud of what massage does and stop looking for things that it doesn't do. I'm really proud of the fact that I can stand on the finish line of an event and I can share that experience with athletes, and I can be a positive part in their recovery without trying to justify it in ways that are physically implausible.
Yes.
To me, it's a huge honor that an athlete would want to lie on my couch for 10 minutes and tell me about their race and let me be part of their come down. That's a massive honor. And we should be really proud of that without looking for another explanation.
So,
Go
because I can. Right, I'm going to jump in and we're going to move to our theory to practice, which is something that's becoming a feature of our podcast in general. And we really wanted to make sure that out of this conversation, everyone who came to listen to us could go away with something practical that they can apply, albeit probably not for a little while, given, as Becky alluded to, the state of current events. But our question for today is, okay, so based on the interpretation of the research, most of us, if we're doing finish line massage, are going to be at events where mostly it's untrained or amateur athletes. So we know we can have, if we're going to have a beneficial effect, it's going to be there. But you've got 5 to 12 minutes. Seems to be the magic window for providing a massage. So Anna Maria, what would you do in that 5 to 12 minutes? How do you use that time most effectively?
Nothing. Apart from the massage itself, I would, apart from giving them a good massage, I would do nothing. I would say nothing. I will listen and I will share their experience with them. I will share their buzzing about the event. I would just listen when they're talking how they felt at miles 30 of the cycle ride. I will use that opportunity for the client to do what they want while I am using my massage. You don't even have to do specific massage techniques. Just give them a relaxing input and a varied input especially into those areas where they feel a little bit so just give a little bit of help them to desensitize the area. But apart from that, for me, language and listening skills are the most important there. And that's where the client will go. You should not hear your voice. I say that to all the therapists. When you are there with your client, no matter what settings, if one hear the therapist's voice more than the client's voice, you know that you're not as client-centered as you should be, and as research is telling us, that's the best way to be in order to give effective intervention.
And that's why we gave Anna Maria a podcast platform to get all of that out so that she doesn't overload her clients. Becky, have you got anything else you want to add to that?
Yeah, so what I'm not going to do is take it as an opportunity to tell a bunch of people how much I know. And I think that I've seen it happen a lot, and I completely understand it, because as a therapist who normally works in your little clinic, it's to be put in front of 1,000 people at an event is a great opportunity to get your business out there, and I completely understand it. But I don't think the right way to make yourself look like a good therapist is to spend those 12 minutes telling that person how they can improve, or things about their posture, or what feels like what, or how much you know about the sport, or how much you can help them with their strength and conditioning. Yet by all means, if they ask you questions that you think you can allude to, but I would be really careful about overloading them in that situation. So I'd maybe say, yeah, it's definitely something we can chat out about. Why don't you give me a ring in the week when you're sort of feeling a bit better? But like Anna said, I don't want to hear my own voice. I want to let them talk. I want to let them enjoy the experience. And I'm going to just put my ego to one side a little bit, because for me, that's what they need.
All right, so that is theory to practice for this week. Obviously, we're on a little bit of a time cap today, just because we want to make sure we get everything out to you. But I'm just going to say, we are keeping an eye on the comments, we're keeping an eye on the Q&A, and anything we don't get round to today, our plan is to actually record some bonus material where we jump in and answer any of the questions that are particularly popular in the Q&A. And we will be posting that within the TherapyLive membership forum. So please do take a look at the TherapyLive membership. It is something that we're really, really excited about. And it will mean that we can continue producing this kind of stuff, which hopefully you're finding useful. So we've talked around the fact that we have a focus almost in the research, and certainly in the teaching when it comes to massage therapy, around the physiological effects. But particularly when we're looking at massage for recovery, it doesn't seem to stand up very well. We've talked about there are psychological effects, and we've touched upon in other podcasts, and we've touched upon in other talks, that the psychological benefits of massage do seem to be far stronger, but they're just not investigated quite as thoroughly as the physiological effects. And that is largely down to because it's far easier to measure something like blood flow than it is about how you feel about your DOMS 3 days later. It's the subjective versus the objective. It's the qualitative versus the quantitative. And yet we are really seeing that the qualitative, how you feel about these things, can be really, really important. And I think one of the things that I think Becky touched on earlier and is really powerful to me, and a place that we really do perform well, is if it's about helping the client feel better, feel they've achieved something, and helping them feel like they can, they're less worried about the DOMS that's going to occur later in the week. They can go back to, I mean, most of these runners and cyclists and triathletes at finish lines, what's the first thing they've got to do? Probably go home and cook dinner for the kids, and deal with the fact that actually they can't just go and lie down and feel sorry for themselves. They've actually got to get on with real life. And if we can provide a form of intervention that has effectively no downsides, provided you watch your language and what you tell them, but in terms of the physical intervention of massage, very few, if any, downsides, you can get in and help that individual cope with the rest of their day, cope with the rest of their week, by making them feel better. What else would we want to do?
I do think, I am just going to counter that, Matt, and say I do think we need to be cautious around massage. And one place I think particularly is in professional sport. And it's something we chatted about beforehand, and appreciate we're really close on time, but the evidence is not strong enough around massage, both physiologically and psychologically, for us to insist on it. And what I worry when I look at professional sports sometimes is that there is this insistence that somebody needs to go for their recovery massage. And I've heard, you watch these documentaries with pro cyclists, and you hear them describing a typical day on a grand tour. And I hear them talking about massage as a chore. It comes in the same breath as their press commitments, as their drug testing. It's like, all I want to do is eat a hell of a lot of pasta and go to bed, but I've got to do all these other things. And that's where, if I'm gonna chuck in, be devil's advocate and chuck in where we shouldn't use massage, it's where it's being insisted on. We're giving it a false belief that if you don't have it, you're going to get injured. And actually it's getting in the way of what Mike James would refer to as the athlete's big rocks, which is sleep, food, water. And I always say, massage should never become before, is your athlete fed, watered, warm and dry? Because those are my sort of priorities for them. And then you can expand that as well. Are they getting enough time to sleep? Are they getting enough time to relax in the way they feel is more appropriate to them? So if I would chuck a spanner in a works, that would be it. And what we look at when we look at all the evidence, every single one of the studies used the word inconsistent. The findings were inconsistent. And in my mind, I went, well, yeah, of course it is, because all athletes are individuals and some of them might not like massage. So we should never insist on it. That's my caveat.
Can I just, Claire's asking, when your client asks what are the benefits to massage, what would be your answer? It makes you feel better.
Yeah.
And that is okay.
Yeah, and I wanted, and Olivia, I do apologise. Your question has been at the top of our Q&A and most voted all the way through, but I thought it was a brilliant one to finish on, which is, so if there are no known physiological benefits, then how would you go around promoting massage and hands-on techniques and how they can help? What would you be highlighting as the major benefits to warrant it in respect to being a useful tool for athletes? And I think that's it. It makes you feel better. And if you feel better, you are likely to move better. If you move better, you're going to perform better. It's that simple.
And I think, and I would just jump in, I know we've got like a minute left, but I would just say, don't underestimate that, and that might take a little bit of expansion in your explanation with your client, in terms of it makes you feel better. Somebody might see that as not of value, but maybe then's the place to have a conversation around the nature of pain and the nature of DOMS, and where feeling better fits into that.
So we are now down to our final minutes. So thank you so much for joining us today. We are the Massage Collective. You can find us on Facebook at the Massage Collective. You can email us at any time on massage@physio-matters.com. You can find us individually. We're mostly on Facebook. We do have an Instagram account, albeit we'd probably need to take some photos and add them to.
I keep threatening to take some pictures of me cupping someone just to upset fairly different people, but I'm not gonna do it.
And we have our podcast, Massage Matters, that comes out every first and third Sunday of the month. Thank you so much for joining us today. It's been an absolute pleasure talking to you. And we hope you enjoy the rest of your day at Therapy Live. See you soon.
Bye now.